Good afternoon, everyone. This is Dr. Armstrong with today's Matters of the Mind. Today, we're going to focus on a clinical examination of suicide prevention. A clinical examination of suicide prevention. So, when we get into this, we're going to be looking at some of the other forms of psychology or psychological strategies to help prevent suicide, as this is Suicide Prevention Month. The etiology of suicide ideation. The etiology of suicide ideation. First, there are psychiatric disorders, which are a major depressive disorder, bipolar disorder, schizophrenia, and other mood disorders that often carry a heightened risk of suicide. The neurobiological imbalances coupled with environmental stressors, they can trigger suicidal ideations. All right? We have to look at the biosocial and psychological aspect of our clients. Then there's exposure to trauma. Now, studies have shown that a significant percentage of individuals with suicidal tendencies have histories of physical and or sexual abuse. Now, this type of trauma can also lead to a host of psychological disorders, which increase vulnerability to suicidal thoughts. Okay? And then we want to look at substance use disorders. Substance use disorders. Substance misuse can escalate suicidal tendencies by impairing one's judgment. And when we impair the judgment, impairing one's judgment, it magnifies the depressive symptoms, boosting impulsivities, okay? Notably, the interactions of substances with pre-existing mental disorders, this can further amplify the risk of suicidal ideation. So we need to be aware of these things from a clinical standpoint, and sometimes we just need to know. Medical conditions such as chronic pain, terminal illnesses, or debilitating disease can lead to the feelings of despair. Okay? The continuous battle with pain and suffering can affect mental resilience. Okay? Now, let's take a look at the indicators of suicidal risk. All right? And this is what you can be cognizant of, which are verbal expressions. Phrases like, I'd be better off dead, or I can't handle this anymore. Things of that direct nature, those are indicators, folks. And that needs immediate attention for a risk assessment to be given. It's crucial. Then we want to look at social isolation. Gradual or sudden withdrawal from social connections or activities once enjoyed can indicate emotional distress. Now, such behavior can be a precursor to more severe psychological issues. Okay? And then we want to look at behavioral anomalies. Okay? Behavioral anomalies. Drastic change in behavior, sleep disturbances, giving away of possessions, or making final arrangements. Those are critical warning signs, folks. Very critical warning signs. So, the strategies for intervention. What might they be, Dr. Armstrong? Here we go. Therapeutic listening. Therapeutic listening. Listening plays an integral role in therapeutic interventions. Listening offers a safe, non-judgmental environment for individuals to express their feelings and even alleviate the distress that they're feeling, okay? Now, the other one will need a little work, which is professional intervention. Professional intervention. Individuals exhibiting suicidal indicators need to go and undergo a detailed risk assessment by a trained clinician. This would include evaluating immediacy of the threat, current mental state, and in the presence of any other planning or intent to take one's life. Pharmacotherapy, okay? Pharmacotherapy, psychotropic medications under the guidance of psychiatrists can help regulate the neurobiological imbalances contributing to suicidal ideations, okay? Regular follow-ups are essential to monitor the efficacy and side effects, okay? And this is a major one as well, folks, okay? This is a major one. Social connectivity. Strengthening the connections with support systems, be it family, friends, or support groups. These can offer emotional stability. Maintaining regular contact, even digitally nowadays, can act as a preventive measure. All right? Stay connected, folks. No matter how, stay connected. Continued management and monitoring. These are part of the prevention and the follow-ups, okay? Follow-up sessions, regular sessions with mental health professionals. This can help in monitoring the individual's progress and adjusting therapeutic strategies, okay? Community support. I'm very, very big on community support. Community-based programs offering resources and workshops and group therapy. All of these can be so beneficial if we just formulate them. Step out of your pride, forget about the stigma, formulate community groups for mental health awareness, folks. Again, education and awareness is what will equip an individual to have the knowledge to recognize the signs in themselves and others. It's a very pivotal role. It's a very, very pivotal role in dispelling the myths and promoting understanding. It is pivotal. Okay? So today, we see how the clinical side of suicide prevention can be very important, okay? But you have a role to play in this. Go to your doctor. Nowadays, doctors are trained in an array of mental health awareness. We listen for certain things, even your medical doctor, all right? We need to have a necessitation of individualized assessments and interventions for our community, all right? If we let this go unseen, you're going to have more young people day in and day out taking their lives. You're going to have older adults taking their lives. You're going to have people with chronic illnesses taking their lives or contemplating it. And one day, the contemplation and the ideation will come true. So folks, today, please be aware of how you feel and how you're thinking. Understand this. We don't want those types of intrusive thoughts to become action. You are important. You are worthy. You are valuable. To someone, you mean the world to them, and they need you. So today, folks, thank you for listening. Have a wonderful day.